UK Healthcare Community Connection is sponsored by UK Healthcare.
And we are joined now by Dr. Justin Fraser from the Comprehensive Stroke Center to discuss the Neuroscience Institute and Stroke Month.
A lot to talk about. Dr. Fraser, May is National Stroke Month. Can you tell us the significance and why it's so important to talk about this?
Well, thank you so much for having me on your show. I really appreciate it. And, you know, we want to just tell the folks of Kentucky, you know, stroke is a major problem in our state. It's the 5th leading cause of death. And, you know, when you think of the United States as, you know, kind of having a stroke belt where stroke is more common, Kentucky, unfortunately, is the belt buckle of the stroke belt.
That's alarming. In general terms, tell us a little bit about the work that's done at your center.
No, absolutely. And, you know, UK is one of 4 comprehensive stroke centers throughout the state. And really, you know, the most complex types of stroke come to us. But I really have to get a shout out to all the community hospitals throughout the state that really triage the patients, recognize early stroke, and get the patients to the treatment they need. And, you know, one of the things that we do is we actually have procedures now to reverse acute stroke, to really try to prevent stroke from becoming permanent. And that's why time is so important for our patients.
And I want to talk more about why Kentucky specifically, but first, when you're talking about signs and warning signs, there is a method, the FAST method, to spot some signs of stroke.
Right, you know, we get this question a lot. You know, a layperson in the community, a person who's not familiar with healthcare, how do they recognize stroke, right? So we say be fast, right? So B stands for balance. So if you saw a loved one who's walking like maybe they had too many bourbons but didn't, you know, E is for eyes. So if they're looking to one side and can't look at you. F is for face. So if their face is asymmetric all of a sudden. A is for arm. So if y'all are sitting at the breakfast table and they just drop their coffee and can't move that arm. S is for speech. So speech means, you know, if you're talking to someone and they suddenly just don't make any sense. And T is for time, meaning we want to recognize when did it start, and then most importantly, being fast about getting those patients in, calling 911, getting into the hospital as soon as you can.
I also wanted to ask you, you know, you mentioned Kentucky specifically has a high number of stroke cases. Why do you think that is?
You know, there are a lot of risk factors that, you know, we look at: smoking, high blood pressure, diet, cholesterol. And most importantly, it's all about access too. Access to good primary care, good community hospitals. And we've spent a lot of time trying to connect with those hospitals to really try to get the patients into the treatment they need as soon as possible.
Well, very important information, Dr. Fraser. We appreciate you coming in to tell everybody about that. You see on the screen there more information if you want to learn more about this. Obviously, in this state of Kentucky, as Dr. Fraser pointed out, it is a very serious issue.
Thank you for being here, Doctor.
Thank you for having me.
We'll be right back.